For decades, women have suffered in silence as their bodies enter menopause. But our social media producer, Karen, was determined to transform her change. Take a look.
I started having hot flashes 3 years ago. They hit you out of the blue, and within minutes, it's like you ran a marathon. I remember being at a party with my friend. I was all dressed up, and I had just a little sip of wine, and before I knew it, it was like... For the next 3 years, it just got worse and worse and worse. I wake up having a panic attack for no reason. In addition to this, I started having just major mental fog. I couldn't concentrate at work. I've always had a really big zest for life, and it was just gone. So after years of dealing with this, I decided that I needed to go see Dr. Asandra. I remembered him from being on the show years ago.
Each individual really needs to be looked at as an individual patient.
I saved his name and I sent him an email. The first thing Dr. Asandra said that we needed to do was take a blood test. I went in for the results, and it turns out my hormones were completely out of whack, and I'm in menopause. He said I was a great candidate for bioidentical hormone replacement therapy. It was a really simple procedure. They numbed it, made an incision, and put estrogen and testosterone pellets in my butt. I was excited about that because then I don't have to remember to take a pill in the morning. I didn't feel a thing. I still don't feel it. I don't know where they are. And then I got progesterone, which I take at night. I just woke up after taking progesterone for the first time last night, and I feel like $1 million. Dr. Asandra said I would sleep like a baby, and I did. It's only been 2 weeks, and I'm already feeling so much better. Decreased anxiety. The mental fog is lifting. I feel like my old self more and more every single day.
Karen and her hormone specialist, Dr. Christopher Asandra, join us today. Karen, great to see you. You look wonderful.
You look amazing, Karen.
Oh, it's so nice to see you guys.
Well, you've been on the hormones now for a few weeks. Tell us, how are you feeling?
I feel great. I feel relief. And I was trying to think of how the best way to describe that. And it's just like easier to be in my body. Like I don't feel fatigue. I feel comfortable. I've always had a really big zest for life, and I sort of feel like my old self again. So,
Dr. Asandra, and Karen experienced a response really quickly after she started treatment. Is that typical?
Yeah, once we get someone's hormones in balance, they can technically feel it quickly. It depends on their metabolism too. But when they go to their regular doctors, they're usually given an antidepressant. They go there and they say, hey, doc, I'm not feeling good. You know what they get? Here's a script for an antidepressant. But they never really check the blood work. And when it comes back, if their hormones are off balance, that's something we should fix because that's really the root cause of the problem there.
And that being said, Karen, what do you think is the biggest change you've noticed since being on the hormones?
Well, my sleep is amazing. I'm sleeping like a baby, and I wake up in the morning and I'm like, hello, world. Like I feel excited. But my anxiety and mood anxiety's decreased and mood has improved. But, because I didn't think, like anybody else, when I had anxiety, I thought, okay, I'm going to go to a doctor, a psychiatrist. But I kind of don't respond well to an antidepressant. And it occurred to me, okay, this could be hormonal. And that's actually the biggest reason that I contacted Dr. Asandra, with anxiety and like that fog, mental fog.